Good morning, class. Today we are going to discuss rotator cuffs, strains, and tears. So the first thing we need to talk about is what is a rotator cuff acute tear. So as you can see here via the picture, we're looking at some different things that could have caused rotator cuff pain. Specifically, we want to look at the tear and what is an acute tear. So an acute rotator cuff tear refers to a sudden and complete rupture of one or more of the tendons in the rotator cuff of the shoulder. The rotator cuff is a group of muscles and tendons that surround the shoulder, providing stability and enabling a wide range of shoulder movements. So an acute tear can be due to a traumatic event, such as an individual falling or lifting a heavy object incorrectly or too fast, or a sudden movement that shocks the shoulder joint. The tear can cause extreme pain, weakness, and affect the range of motion greatly. First thing you want to do is, if you suspect something like this, is you're going to want to get some medical attention, because you're going to want to verify that nothing is torn, and the level of rehab can be determined from there. And we're going to get into that more later on, but early intervention is key, as with any injury, because the rotator cuff affects a lot of quality of life as well. So the structures involved in an acute tear, you have a lot of tendons that are connected with the rotator cuff due to its location and what it does for the body. So you have the serpentineus tendon, the infracutaneous tendon, the tres minor tendon, and the subscapularis tendon. So as you can see via the picture, how everything is interconnected in the shoulder, all of this stuff, if anything was to be torn with an acute tear of the rotator cuff, could cause great pain and very, very limited movement. And you can see how much it affects, because it is what helps connect the arm to the shoulder and the upper body. So how this injury took place for our individual. So while at work, our patient serves as a crew chief in the Air Force, and they were installing a landing gear strut. This item weighs roughly 500 pounds, and even with a team of individuals, could be lifted improperly. So when lifting the strut, the muscles of the shoulder, including the rotator cuff, engage to stabilize and control this movement. However, if this load was too heavy and was lifted with improper form, it could have overwhelmed the capacity of the cuff and resulted in an acute tear. So even in a team of people, if things are lifted improperly and weight shifts differently and causes that, and you're not ready to brace for it, which is what happened in this case. Our individual was lifting in a team. The weight shifted abruptly. They were not ready for it, and their arm and their body was not in a position to catch that weight. And it dropped dead weight on the arm, and it caused the arm to pull down and caused the tear. The forces that contributed to this injury can be attributed to a combination of forces. As I said, first, the weight of the object itself places a substantial load on the shoulder joint. Secondly, the forces involved with the lifting motion, such as pulling and upward acceleration, create additional strain on the rotator cuff. Finally, the lifting that was done improper placed excessive strain and these specific tendons, and it compromised the stability of the joint. All these forces together are what cause the acute rotator cuff tear. So rehab safety protocol. So as we all know, safety is key. How do we get somebody through the rehab process, and what kind of protocols will we use? We will use pain management, gradual progression, proper technique and form, avoiding overload and overuse, and clear instructions and education. First, to start with pain management, we need to ensure that we manage the pain as we go through rehab. Now, this means that we could use some different medicines and things like that. We could use some localized treatments to decrease the pain if the pain is just way, way unbearable. But we also need the individual to potentially work through the pain. So we need to manage their pain, manage their expectations, because too much pain is one of the biggest detractors to people not successfully completing a rehab course. That kind of ties into gradual progression. We want to go through this slowly. We want to make sure that the individual gets comfortable, that we move through this, because if we go too quickly, we go too fast, we chance not healing or re-injuring this part of the body. Ties into proper technique and form. We want to make sure as we're doing these exercises with the individual, they do them the right way. This is key to the rehab, but then key to when they leave us and kind of ties into clear instructions education as well at the end. We want to make sure that they understand how to lift things, how to do things. Maybe you weren't doing this in the gym. Maybe we need to get you in the gym and doing some shoulder exercises because this is how your daily work life is. And avoiding overload and overuse. So if we get somebody in a strength training program, we can build up what overloading is because it'll continually get bigger, right? Guys and gals who go to the gym, they work out, their muscles get bigger. Overloading is not that much because they're stronger, they're getting bigger muscles, they're having a bigger muscle capacity. Overuse, however, is something we need to look at. Does this individual do things like a baseball pitcher where a rotator cuff tears are very common because of the constant repetitive use? So, okay, hey, maybe this is how you work. This is what you do. Maybe we need to look at how can we work with your work center and things like that to make it so you're not repetitively doing things that can potentially re-injure that. And then down to the clear instruction education. While we're in the program, it needs to be clear and concise, but when they leave the program, they need to be able to continue on and hopefully are educated and able to work out, do all the things that they need to do without re-injuring their shoulder. So how age and gender affect rehab. Age is the key because you have a slower healing process and reduced tissue quality and a prolonged recovery time as you get older. This kind of is regardless of how extremely healthy you are, things like that. It's just the way the body is. And other things as you get older are decreased muscle mass, joint stiffness, and usually overall fitness. People tend to not go to the gym as much as they get older because they're getting older. They're enjoying different things and doing different stuff. So our protocols need to be tailored to older patients if that's where we're at. And there are some differences in rotator cuff tear incidents and characteristics between genders. Research suggests that men are more prone to rotator cuffs tears, particularly as they get older. And that's because they're trying to do a lot of things, a lot of stuff around the house as they get older, as they're retired and stuff like that. So we just need to take a look at like, okay, what are you doing outside of maybe work? What are you doing in the home? What things like that do we need to look at? And try to stay away from gender biases because it could be anybody, but there just been some studies that have shown the gender fact. So our rehab protocol, we're going to look at initial mobilization, pain management, physical therapy, strength and exercise, look at some control, and then gradual return to activity. So initial mobilization is like, hey, you know what? We're going to put you in a sling and we're going to rest you. We're going to let your body start to heal. We're going to work with potentially some anti-inflammatory drugs to manage your pain, keep the inflammation down as we roll into physical therapy, which is where we will start the slow progress of getting back in with that initial mobility. Once we can get that initial mobility, we'll look at some strength training exercises, some things to potentially get that strength back in the shoulder. We'll probably start out with resistance bands, do some functional movements and things like that. And then we'll want to improve your balance, coordination, and ability to control your shoulder movement. So that's where the proprioception and the neuromuscular control come in. We really want to make sure that you can have control and good posture with your shoulders. And then gradual return to activities. Once we've started to roll through all this stuff, we'll get you back out into the gym and get you doing what you enjoy to do, but hopefully educate you to have a reduced load on your shoulder. In order to start your rehab, we'll look at something like a pendulum swing, which is where you just kind of swing your arm back and forth. You can see in the picture here, kind of bent over a chair, going around like a pendulum. The key here is just to like get it moving, relieve that stiffness, get some circulation, and start to hone in on mobilizing that shoulder joint. Then we'll look at isometric external rotations. This is just where you kind of put your arm at a 90-degree angle and kind of make your forearm go out away from your body. This is going to work on muscle contraction without joint movement. This is key because it's really going to get the muscles working without really doing too much things with your joints. We could use resistance bands here, but to start out, we would definitely not. And then scapular retraction. This is where you kind of roll your shoulders back in your scapula. This works all of the muscles that surround the rotator cuff as well as help with stability. If you have too much pain, we'll use passive range of motion exercises and isometric contractions. This is moving muscle without moving the joints. This is maybe where the therapist is kind of the one moving your arm around and doing different things. The key here is you're in a lot of pain, and it's going to cause you to have to stop and stuff like that. But we really want to not get stiff, not cause regression, and not hold up the healing process. So this is where somebody might move your arm around and do different things to kind of get the process started if you're under too much pain. Then how do we get you back to normal life? So we need to look at the healing process, pain and discomfort, and range of motion and strength. So the healing process is the first and foremost. As you've gone through the process of physical therapy, we'll look at, hey, like, are you healing? Are you getting, is the actual tendon healing? So we might do an MRI or an ultrasound, some image testing, some medical diagnostics with the doctor to really look at, okay, this is healing. And then we'll look at your pain and discomfort. Are you in a lot of pain? Are you discomforted by what's going on with your shoulder? Because maybe you're healing and you're starting to feel better. And then we look at your range of motion and strength. Is your range of motion coming back? Is your strength coming back? Are we looking at that progression, like we said, that slow, sweet progression as we go through the stuff? So if you're healing, your pain and discomfort levels going down, and you're getting your range of motion and strength back, that's when we would start to kind of get you back into that normal day-to-day life. And here are my references. Thank you very much, and have a great day.